Medicare for all should look like. Here we are early in 2020. The race for the presidential bid in the United States is heating up. And I just want to talk about medical insurance in the United States. I've done multiple shows on this in the past, and talk about how this should work no matter who wins the White House. If it's a green rainbow candidate that gets in, it doesn't matter. An independent, a Republican, a Democrat, it doesn't matter to me. Just somebody that's going to go in and make some corrections. So a lot of the proposals now are talking about increasing insurance coverage, which I think is a good idea. And maybe Medicare for all is talked about as well. So here are my comments. If we have insurance coverage for all, I don't see how that's going to change health outcomes for the population. If we get everybody insured, I don't see how that's going to happen. We already have a system that's not working, it's broken. It's extremely expensive, and people are not getting healthier, we're getting sicker. We're spending more and more money every year on chronic diseases and managing chronic diseases. And in these discussions, I hear very little about addressing this phenomenon. Our CDC had said years ago, Centers for Disease Control has said 75% of what we spend our healthcare dollars on are for things that we can prevent. And how can we prevent these things? We prevent them by as follows. Having people having clean nutrition, regular exercise, taking care of the spine, water intake to appropriate, and reducing stress. If we do, and if we address those things and get really serious about that, then we improve people's health. We reduce chronic disease, and I'm talking about the big four: heart disease, cancer, diabetes, and Alzheimer's dementia. That's what I'm talking about. If we do these things, these four things that I just talked about, which consume a big chunk of all of our healthcare dollars, goes in the basement. So if we're going to have Medicare for all, or insurance plan for all, or if we're going to have a change in the healthcare delivery system in this country that's going to have everybody insured, whether it be Medicare, private insurance, balance, mixture, whatever it is, if we really get serious about this, and we have the technology, we have the people, we have the facilities to do this, and if we do it, then we're going to have a healthier nation. This is what everybody wants. As I wrap this in, I'm going to show you how we can also create jobs. And I think it's close to 10 years ago I did shows on this, how to create a healthcare system that also creates jobs. Go look it up. I think it's on my YouTube page. So what do? What we're going to have is everyone, as they get this insurance coverage for all, we're going to make the following free. Nutritionists. You can go to a nutritionist at least once a week for free for the rest of your life. Let's call it daily if you need it. Next, you're going to have chiropractic care on an ongoing basis, free, to take care of your spine and your chronic problems, on arthritic problems and neck and back trouble. The number one reason that anybody calls any doctor at any time is for back pain. It's the number one thing that anybody has. Chiropractic has been shown to be one of the best ways to address that, and it actually has been shown to be better than the best drugs that are offered for back pain. Chiropractic. It's included. You can go once a week for life, free, under this insurance plan. Next, number 3, a personal trainer. You can go to a personal trainer at least 3 times a week for free for the rest of your life. Personal trainer, free. You can go to a workout facility and walk in, and it is paid for, free. Physical therapy. You can go to physical therapy at least once a week, just like chiropractic. You can go once a week, free, to address your joint issues, muscle issues, imbalanced stuff, whatever might be going on. You can go, and it's free, forever. Massage. You can have a massage once a week, that's right, included with insurance, for free. Acupuncture, also free, once a week, for life. All right, So how do we pay for this? Well, we pay for it because of all of the money that we would save by reducing chronic diseases. I don't have this all figured out quite yet, but there would be a transition in here as we're handling all of this. Now, with this, we're going to need more nutritionists, we're going to need more chiropractors, we're going to need more physical therapists, more acupuncturists, more physical therapists, more acupuncturists, and so forth. We're going to need more of these people. Oh, and the last thing on this list too, let's include stress reduction techniques. So that means we can get psychologists and psychiatrists involved. We can get meditation people involved and yoga people involved. We're going to wrap all of these people in here as well as one of the other services that is offered. Okay, so all of these things are paid for with stipends, with whatever it takes, coupons, and so forth. There we go. Okay, now even with that, would that make a dent? I think it would, even if we just provided these services here, free. Maybe it ends up being at a reduced rate. Maybe it's income related, I don't know. Maybe it's income related, and if somebody is very low income, they're free. And if somebody is moderate income, they have just co-payments that they pay that are small enough to allow people to go. If you have an insurance plan that I have right now, so I have private insurance right now, I have a $50,000 deductible, a $900 co-payment, or whatever it is. So basically when I have any of these services, I'm paying whatever the allowed amount is, okay? For a lot of people, that is a hurdle. They just can't go. Even though they are covered by insurance, and insurance will pay for a personal trainer, physical therapist, chiropractor, and acupuncturist, whatever it is, they just can't go on a regular basis because the copayment is too high, the deductible is too high, they're paying the allowed amounts, right? So we need to change that. So it down so there's a low copayment for moderate income people and so forth. Lower income, it's covered at 100%. Sounds like it's a good plan. Okay. The other thing is as we're dealing with this, is we make sure that the SNAP program, the Substitute Nutrition Assistant Program, also used to be called food stamps, that is altered in a way that cheap calories that taste good, that make us diabetic and giving us heart disease and cancer and Alzheimer's, which is processed foods, snacks foods, soda, and added sugar. All of that is really cheap because we subsidize that by growing these monocrops of corn and soy and so forth. So those calories are cheap. So if somebody's on limited income and they're giving food stamps, I'm just going to call it food stamps, and they're giving food stamps, they end up buying things that are cheaper that also taste good and keep us addicted. Let's call it soda and juice and processed foods and chips and crackers and candies and so forth, which keep us fat and sick. So we enter the disease care system. We have chronic diseases which cost us millions of dollars per person for the lifetime of that individual. But if we do this program here and go with that, now we have somebody that we don't spend millions of dollars on or hundreds of thousands of dollars on in their lifetime. We can also take these food assistance programs and we make it go extra miles if they do vegetables and organic vegetables, organic meats, organic fruits. They basically have that unlimited per month, unlimited, where the delicacy items, we'll call it the processed food items, only goes this far. I don't have that figured out yet. Again, if I was the king of the country and I had absolute ultimate control, I would make a bag of chips $75 and make it 30 miles away. But the bag of broccoli would be 5 cents. The soda would be $25 a can and 40 miles that way. But reverse osmosis water in a glass container would be free. You follow? So, but I'm not the king. So we have to have something, a program in there to help people with food that builds health and nutrition, prevents disease, and doesn't do that. So, full circle, if we're really going to get serious in this country to help each other enjoy a more fulfilling, a life of satisfaction, a life hopefully mostly free of chronic diseases, we're going to do a program that wraps this into the healthcare changes that we need to do. Okay? I'm Dr. Scott Fuller. Please join me again.